Hello, everyone, and welcome to our second APRU Global Health webinar series, organized by the APRU Global Health Program and co-hosted by the USC Institute on Inequalities in Global Health. I'm delighted to have you all joining us today. I will be the moderator. This is the second webinar in our series, and the topic is Bioethics and COVID-19. We have Professor Angus Dawson from the University of Sydney joining us, and I'll tell you a little bit more about him in a moment. But I just wanted to remind you that we have 8 weekly webinars. This is our second, same place, same time. Also, a little bit of background about APRU. So APRU was established in 1997. It's a nonprofit network of more than 50 leading research universities in the Pacific Rim region. The Secretariat is based in Hong Kong, and the Global Health Program was established more than 12 years ago. It's housed at USC at the Institute on Inequalities in Global Health, and I am the program director. The aim of these webinars is really to showcase the expertise within our network and to address issues around the pandemic from various perspectives. So just a little bit of housekeeping first. I encourage you to type in questions into the Q&A. We'll make sure that we have time for Q&A after Dr. Dawson's talk, and I'll be curating those questions, so I'll be looking at them throughout the talk. Also, please share this webinar and tag at APRU 1997 on Facebook and Twitter with the hashtag APRU+. We'll type that in also to the chat box. For more details about the Global Health Program, you can visit apru.org or apruglobalhealth.org. And for more information about the webinar and series, you can visit apruplus.org. So let me tell you, Dr. Dawson is Professor of Bioethics and Director of Sydney Health Ethics at the University of Sydney in Australia. His work increasingly focuses on working with organizations to embed ethics into policy and everyday practice. He is the joint editor-in-chief of the journal Public Health Ethics and was one of the editors of a case studies book, which can be downloaded for free, and I'm going to put that into the chat box as well. If you will be taking our distance education course on bioethics this fall, we're going to be using that book. I'm not sure if I told him yet, but anyway, I don't want to take up more time, so I would like to go ahead and welcome Dr. Dawson. Thank you so much.
Thank you very much, Melissa. So I'm hoping that this is now okay. So hopefully everyone can now see my slides. So thank you very much for being here today, whether it's tonight or this morning. I'm going to talk today about some bioethical issues related to COVID-19. And for some reason, okay. So I want to begin by saying a little bit about ethics, because there are a whole range of different topics that are being looked at in the seminar series that's hosted by APRU in relation to COVID. And one of the things that's very interesting about ethics is that we're focusing on lots of different reasons for our actions or our policies. And the particular kind of reason that is most important is ethics is what we can call a justificatory reason. So that's a reason that's providing a special kind of reason for an action, looking at something, for example, about how we ought to behave, how we ought to act, what a justification might be for the actions that we're interested in. And one example might be, for example, we have a range of different options and we might be concerned about trying to think about which of those options actually brings about the best possible outcome. So we might be interested in concerns about justice, the distribution of those outcomes, and that might be the basis for our choices. So the main focus of my talk is then thinking about a particular aspect of ethics, which is called bioethics. And we can break this up from the origins of the word. So bio meaning life, and ethics in the sense that I've just been talking about. So a concern about various kinds of normative reasons. And I would argue for a very broad definition of bioethics that then covers a lot of different sub areas. And today I just want to say a little bit briefly about 5 of those different areas and say a little bit about each in turn. So I'm going to start at the highest level in a sort of geographical sense, and that's global ethics. So why we should be thinking about global ethics in relation to COVID-19 is because we're dealing with a pandemic. And one of the interesting things about many infectious diseases is that they spread through the movement of people or animals and so on, but they tend not to respect borders. So in a pandemic, we have the greatest possible spread, and we truly have, with COVID-19, a global focus on thinking about this. And I think there are a number of consequences from thinking about COVID as being a global ethical issue. So what I mean by it not just being an outbreak is that this isn't something that is just of concern to an individual country. When there's an infectious disease outbreak which is localized, such as say a TB or a malaria outbreak, then there are the main responsibility for that is going to lie with a particular national government. But if we're thinking about global ethics, we're thinking about pandemics, then we have to notice that we're essentially relying upon the coordinated actions of many different nation states. And that means that the progress in relation to responding to the disease, how adequate that response is partly reliant upon how well countries share information, interact together, act together to try and coordinate the response. And the kind of legal framework for this under the international health regulations is something that tries to balance different kinds of considerations. So both ethical ideas about things like the importance of freedom of movement and so on, circulation of goods, so for economic activity, but also tries to allow for the fact that it's justifiable to have certain restrictions when they might improve everybody's health. The other interesting issue related to global ethics, which I'll be talking about later on, but we should mention here, is that of course, if we're talking about different countries, then we have different cultures, different religious views, different healthcare systems, different political structures and attitudes, and all of those can make a difference to how the infectious disease response might actually go. And I think we're seeing that play out across the world at the moment. The second topic that I'll focus on in this talk, so thinking again about bioethics as a broad umbrella, is moving down a level and thinking about how public health ethics relates to issues in particular countries or even regions within countries. So the focus in public health ethics is on thinking about the health of populations, not just individuals, although individuals, there's no reason to see them as being necessarily sacrificed for the good of the population, because in one sense, ultimately a population is made up of lots of individuals. But the second element that's often forgotten is that public health requires the collective action of many individuals to actually ensure the health of the population that we're actually interested in. And that's why a lot of public health activity is actually coordinated through governments at different levels. But the role of the state is really important in relation to protecting public health. And there are different ways that we can sort of break down the responsibilities here for what public health ought to be focused on. But I put down here sort of thinking about the protection of people's health, thinking very importantly about preventing the infectious disease spread, and also planning in the pre-pandemic phase for what we should do once or if a pandemic hits, but also taking responsibility for planning the actual response itself. Related to thinking about public health ethics and some of the issues that have been talked about a lot in the literature, we can think about the actual detection of cases, so ideas about surveillance there. So public health really relies upon good quality surveillance, by which I mean performing various activities that allow us to detect early the cases that of a particular disease that might be in the particular jurisdiction of a country, so that you can actually plan your response. So once surveillance has detected sufficient cases, then you might move to the next step of thinking about various restrictions. And I think almost all of us around the world now have had the experience of what it's like to actually live in a world with these kinds of restrictions. In the past, perhaps we've thought about these as in a quite theoretical way, but many of us now have experience of this. So by quarantine, I'm thinking about the isolation of individuals who might have been exposed to the infectious agent. So in the case of COVID, many countries now have a 2-week quarantine before you're allowed to freely move around in a country. Isolation is when we have a confirmed case and we want to ensure that that person transmits that to as few people as possible. We have, of course, physical distancing, which we're now all very aware of, attempts to try and reduce the kind of social activity in society that might increase the chances of infectious disease spread, and also the closing of borders to try and protect a population where there might be few cases from external infection into that country. And then the next set of issues related to another traditional activity of public health, which is thinking about contact tracing. So here, where you have a confirmed case, you're looking at who that person might have come into contact with and then following up with them. But of course, that can generate all kinds of potential ethical problems when somebody has actually been interacting with other people. Some of those interactions might be embarrassing or confidential, and we need to think about how this is actually conducted. Who does it and how do they do it? Who actually has access to the information? And there are some attempts, of course, been going on around the world to actually think about how we might use technology to actually further some of these aims. And the last point I make here, again, is to point out how many of the issues that are talked about, many of the values that are discussed in public health can overlap with, but some of them differ from those that we see in other parts of bioethics. So it might be that in some areas there's a real focus on thinking about ideas like liberty and privacy, that they're sort of protections for individuals. But when we're talking about public health, we have other kinds of values that come into play, such as ideas about justice, solidarity, and so on. So I think my last slide on public health ethics is to say a little bit about the impact of our actions. So what are we actually trying to do here? How are benefits and burdens distributed? One of the reasons for the kind of physical distancing that many countries have introduced is an attempt to protect subgroups within a population who are at greatest risk. So in relation to COVID, we're particularly talking about elderly populations. So there is increased risk as you age, certainly when you get over 60, and chronic conditions that might pre-exist the disease increase your risk at all. So what's interesting is that the public health response here is essentially justified by an attempt to protect some people who are vulnerable in the population. And that's because of the absence that we have for any effective vaccine or treatment at the moment. Even if we think it's justifiable to have these kinds of restrictions that I was talking about on my previous slide, we need to make sure that the restrictions are actually acceptable to the people that are affected. So that's why many governments have responded through economic support to people to make sure that not everybody suddenly becomes unemployed as we sort of restrict our social and economic interactions. And we also need to think about the mental health implications for the people who are in isolation. So how can we support the necessary consequences of action that's taken to support public health in this case? And then lastly, I think we need to think very carefully about how public health measures aren't going to impact people in equal ways. So we have some groups in society who are going to be potentially disadvantaged by our interventions even more than they already are. For example, they might be at increased risk because of being in a limited setting. So some migrants, for example, refugees who might be in a camp, or people who are in a prison, you're in a particular enclosed environment. And it might be that as long as the infectious disease, in this case, COVID, remains outside of the camp, of the prison, then you are safe. But once it's inside, then because of close living conditions and the poor conditions of people's health in many cases, it might be that there's a real danger of transmission in those environments. So you might actually be at increased risk. So the third area of bioethics I just quickly wanted to mention was thinking about clinical ethics. So clinical ethics is what I think many people think of when they think of bioethics in general. So clinical ethics or medical ethics, here the idea is that these are the ethical issues of everyday interaction in the form of clinical encounters. So going to see a doctor or a nurse. And this has perhaps been the dominant area in bioethics, that people write about this the most. And there can be a focus on issues like informed consent and confidentiality, issues related to that relationship between the healthcare provider and the patient. But there can also be other issues that then shade into more general political and population and public health issues. And in relation to COVID-19, one of the ones that's really come to the fore is resource allocation and thinking about how we might distribute resources when they become limited. And this is an interesting theoretical exercise, but it's also something that has really happened in some parts of the world. So one of the reasons why you might want to think about this in advance is to actually protect and support the kind of stresses that might come from healthcare workers having to make these decisions on the fly in response to the situation immediately before them, rather than planning in advance for this. So there are many different kind of resources that we might look at, but there's been a lot of work done on thinking about the allocation of ventilators or intensive care beds if we don't have enough of them for the people who, because of their clinical condition, it's indicated that they should have access to them. So there are a number of possible options for how we might theoretically think about responding here. We could treat everybody equally, and some people have said that we shouldn't, for example, take into account what we believe are people's chances of surviving. We should effectively have a random allocation. So we might have something which is either literally a lottery or some system which is similar to a lottery to actually distribute places. And the thought here is that that's a way of showing equal respect to everybody, because everybody has an equal chance of actually having access to the relevant resource. Many people would criticize that and say that doesn't make any sense. You know, if we're really in a crisis situation where we really have limited resources, then we have a duty to use those resources efficiently as possible. And we have to take into account the actual chances of an individual surviving and recovering. We have to use the resources efficiently as a way to we basically have a duty to do that, rather than just distributing these resources equally. So that's a concern about thinking about the best outcomes, and we can define that in different ways. But this is going to be controversial because there are different things that you might choose to focus on. For example, there will tend to be a bias in favor of younger people over older people, and that's because best outcomes, one of the relevant factors might be the length of life post intervention in terms of being on something like a ventilator or in an intensive care bed. So it's up to the particular approach or the particular system to actually think about how we define best outcome there. But essentially the focus here is on trying to be efficient with our use of resources and taking that as a moral requirement, not just something to do with economics. And then the third possibility is to argue that we could actually look at previous disadvantages in society that have had at least some kind of causal role in thinking about the chances of people actually having different outcomes when it comes to the intervention. So, for example, why is it that some people have prior chronic disease that might put them at disadvantage? In some cases, that might well be due to poor living conditions and poor socioeconomic conditions. So the danger is that if we don't take this kind of disadvantage into account, you might be penalizing people a second time for the consequences of previous disadvantage in society. So these are complex issues that are being discussed in many different countries, And people have come up with different ways of thinking about how we should allocate these different resources. The fourth area of bioethics I want to say something about is research ethics. And the thought here is that there are, because we're with COVID-19 in a situation where we don't have existing effective vaccines, we don't have particularly good treatments. Some of the symptoms can be treated, but there is no available effective treatment for the disease itself. So there is a lot of work going on all around the world in terms of exploring different vaccines and different treatments. And when we have this kind of innovation, of course, we have research ethics as being a really important element to think about. And I just wanted to touch on one issue here, which is that some people have argued that because of the global burden in relation to the number of people that are impacted by COVID-19, both from the disease itself, but also from the social and economic consequences, we have to produce, for example, a vaccine as quickly as possible. And they have then gone on to say, how can we ensure that the approval process is as speedy as it can possibly be? And there have been various proposals to try and shorten the approvals process for a new vaccine. And there is a set of issues that need to be explored about how much risk we should actually be willing to accept in that kind of case. So if we have an effective and safe vaccine, then clearly there are huge benefits to the global population. So the number of people that are impacted from that could potentially be huge. But there might be various risks from vaccination, either within clinical trials or more generally as a vaccine is rolled out. Because if you're talking about vaccinating 6 billion people, even a very rare risk will be something that might actually happen to many people. So that's an issue that is currently being debated, this kind of idea about moving from producing a vaccine as quickly as possible against thinking about what that means for our traditional approach to developing a new product such as a vaccine. Should we be, for example, skipping over some of the different phases that there are within clinical trials? Is that acceptable? Is there sufficient justification for doing that because of the potential benefit to such a large number of people? And finally, the last thing I wanted to mention was how I personally think that bioethics as an area of activity, as a discipline, should actually be overlapping with thinking about environmental ethics. And I think here we have a good example where the virus actually comes from animals, from bats, and arrives in terms of impacting humans as a result of almost certainly human activity. So whether that's the impact upon the original environment where bats are living, interacting with them, providing a foodstuff in some places. So many people are now advocating within public health for what's called One Health, which is thinking about the interactions between humans, animals, and the environment. And one of the ways that I think bioethics will move in the next few years is to try and think about how there's an area of applied ethics called environmental ethics, how some of the issues that have been well discussed there can be brought back into the mainstream in relation to bioethics. So the questions that I have here are, the kinds of bioethical questions that we might ask from the perspective of environmental ethics. So a big issue coming out of COVID is thinking about how we balance health and economic considerations in relation to intergenerational justice. There are many younger people who have undergone a tremendous burden as a result of the physical restrictions. They might actually have a lifelong burden as a result of these measures. What does that mean for thinking about what we should do as a compensation towards them? And many of us have noticed that various aspects of our environment have actually improved as a result of the kinds of reduction in economic activity. So air quality has improved. We're perhaps producing fewer emissions that are impacting upon the environment, etc., etc. So do we have the possibility to actually benefit from some of these changes? And as we move out of the immediate response to COVID, can we actually think about taking advantage of some of these? So I think when we think about COVID, we have to sort of accept that it's something that has really transformed all of our lives over the last few months. We need to think about the fact that we are not all equal in our capacity to respond, and that's true as individuals, but also as countries across the world, because we have different healthcare systems that have different mechanisms for how they support and respond to the needs of different people. But I think we have some potential reasons for optimism. I think we've had a real illustration of how concern for others, particularly those that might be at higher risk from the disease, can be protected. And societies as a whole have taken on a significant set of costs in order to protect them. I think we've seen a growth in solidarity, both within countries and to some degree between countries. And I think we need to make sure that we're telling a positive story where we can about what the impact from COVID has been, that we don't just focus on all of the costs that there have been. So coming back to the overall theme of my talk, I'd argue that bioethics is a broad field. I've tried to illustrate 5 different sub-areas of activity. There are actually many other areas within bioethics that I haven't talked about because they're not so directly relevant to infectious disease, but there's lots of great work going on there. But one of the things that bioethics as an activity has in common is this idea about trying to think about what the conditions are for us all to actually have flourishing lives. And maybe that should be flourishing lives within a healthy environment. So there are many different bioethical questions to discuss, certainly many that have come up over the last few months in relation to COVID. And I look forward to hearing your questions and comments.
Okay, thank you so much for that wonderful talk. I really like the idea of thinking about the positive impacts as well. And actually next week, our webinar, I think, as you know, is about environmental impacts. So we have a number of questions. So let me go ahead and just get started. The first one comes from our good friend and advisory board member, Erlinda from the Philippines. She asks, what is your take on the public health measure of banning health workers from leaving the country during the COVID period? This has been critiqued as a violation of human rights.
Yes, so one thing that could be said in its favor is that healthcare workers are themselves a limited resource, particularly at times of a pandemic, and societies will do what they can to try and ensure that they retain as much of that resource as possible. But I think the other thing that we can say is that this is just a particular example of a more general problem that has been the subject of quite a bit of discussion in the bioethics literature about how some economies have the advantage, because they can pay higher wages, of sucking in healthcare workers from countries that have lower incomes. There are more job opportunities and so on. So it can be very attractive to kind of move in that kind of context. But yes, I mean, it's maybe problematic if we're restricting people's freedom of movement, but then many different human rights have to be balanced or weighed or potentially compromised when we come to the kind of pandemics that we're talking about in this situation. So I think there are a number of different things to be said on either side, and I don't know enough about the particular example which you're talking about, but I think that's definitely something that we ought to focus on exploring in the future.
Thank you. Okay, we have another great question. Coming from Carrie, could you comment on data ethics in the context of the pandemic? How do we balance personal privacy with public health goods that can arise from the use of these data?
Well, great question. And again, something that has been discussed quite a bit in the literature. So I think a lot of this comes down to the advantages that we might have through having that data. For example, within a surveillance system, public health can have very good reasons to try and understand what the levels of infection are in different regions or different cities across the world, and then use that to plan for how they're going to respond. So you basically, if there's part of the country which has greater disease, you want a greater emphasis on responding in that particular place. You know, in many ways, it might be inappropriate to equally distribute that the resources that you have equally across the whole country. But one of the concerns here is what actually is the data that we're talking about, and how much is it identifiable data in relation to the particular individuals. And of course, there's been lots of discussion about the different kind of apps that have been developed to respond to picking up on cases, and how there might have been contacts with others through following individuals in societies. And some of those, the data is identifiable, and some of it is not. So I think we shouldn't just think, have we got public good versus privacy? There are ways to try and think about how they're both important, and we can put protections in place for example, putting coding attached to individual level data to make sure that individuals can't be identified. But of course, it's to all of our benefit to actually be able to pick out the individuals who may be infected, because we can help them, but we can also see them as being a potential source of infection to other people, and we need to know who's come into contact with them. This is even more important in situations where you might have very little background transmission within the community, and you're really in the stages of having very few individuals who are infected and infectious. And you, at that point, really want to identify those particular individuals. But that doesn't, of course, mean that we're publishing their names and their photographs in the newspaper or something like that, or broadcasting on TV. that's going too far. So I think there are all kinds of opportunities for trying very practically to balance the different relevant values.
Yeah, I mean, here in Los Angeles, I know we have a huge contact tracing department for sexually transmitted infections, and we've been doing this for decades, and there never seemed to be a big backlash, which is sort of interesting that now there is. I don't know if it was just simply people didn't really know what contact tracing was, or because a sexually transmitted infection is different than COVID-19, and so they're perceiving different ideas about it. It's been quite interesting to me to see that. Okay.
Yeah, I think that's right. That and one of the things I was emphasizing in relation to surveillance and also contact tracing is that they are routine public health activities, and lots of people don't know about them until they are contacted. But there have been controversial cases in the past. I mean, in the early days of HIV and AIDS, for example, it was extremely controversial when being identified as being HIV positive might mean that you lose your job, you lose various kind of social protections and so on. So I think we need to think about what the consequences could potentially be from public health interventions and make sure that we are prepared and that we thought about how the burdens might fall unequally within a population and how we ensure that everybody is protected from the relevant fallout from these very important measures.
Okay, thank you. So we have a question now coming from Rolando, who asked, a number of governments have used the COVID-19 induced restrictions, e.g. ban on assembly and free speech, as an effective tool to suppress activism and opposing ideas. What is your take on this?
Well, I have to agree. That's certainly been the case in many different parts of the world. And it's something that's of direct relevance here in Australia. So because of the Black Lives Matter protests and thinking more broadly about inequalities and the actions, the impact of racism, there was a demonstration in many different cities in Australia last weekend, and there'll be another one. I think it's today, and the government is encouraging people not to go and saying that protests are potential sources of infection and are likely to increase the chances of us going backwards in relation to having more cases and so on. And I think there's a similar kind of argument that was being presented in many different places, including the US, many other places where these protests are going on. And I think it does come back to thinking about how there are a number of different relevant considerations. The ability to state your political views and to take action and to protest, that's an important right that many societies will take seriously. And one of the things that we could think about is how we might weigh that against the increased chances of infectious disease spread. And that, for example, in thinking about the balance there, we might think about how you could protest with as little chance of transmission as possible. So wearing face masks, being so physically distanced as part of the protest and so on. And I think it's certainly the case that the protests here in Sydney, the people on the protest were wearing masks and trying to keep their distance from each other as part of the protest. But the police weren't wearing masks and they were all hanging around together. So I think there are interesting questions if there are outbreaks that are blamed upon the protest. on where exactly they're coming from. So personally speaking, I think we need to watch out for governments taking the opportunity to exploit the particular circumstances for their own benefit. And I think it's very important for people to have the right to express their views. And I think as long as they're doing that responsibly, I don't see any problem in that.
Okay, thank you. So the next question comes from another good friend from Delhi, who is actually a human rights attorney there and a speaker in our bioethics course. And she asked, when dealing with equal opportunity to treatment, must we treat our affected health workers on priority basis compared to others in such times, or even within the subset of health workers weigh a production of best outcomes?
So, so where healthcare workers come in the priority list of those within a triage system is, I suppose, something for every healthcare system to think about. Generally speaking, I think there's a strong argument for having healthcare workers as being like at the front of the queue when it comes to any kind of resource allocation, partly because we can, again, as I mentioned before, in relation to another question, we can think about healthcare workers as essentially being a limited resource that we want to protect for the good of the whole of the population within a pandemic. So it's in all of our interests to actually ensure that healthcare workers are protected. And that's why things like PPE are so important in this kind of context, and why it might be appropriate for healthcare workers to restrain themselves from certain kinds of actions that they might otherwise perform. So for example, if somebody in hospital has a heart attack and you know that they have the relevant virus, then it might be that normally people would just respond immediately to that to address the heart attack, but perhaps there's a responsibility to think about the relevant protections, putting PPE on and so on, which is going to delay the intervention and will potentially have consequences for that individual. But that's a healthcare worker taking responsibility for their own actions, thinking about their contribution to the overall societal response in this case. The other thing is that healthcare workers, why they might be at the front of the queue, is thinking about ideas like reciprocity. So because they are on the front line, they are potentially putting their own lives at increased risk. And we've seen all around the world that it significantly increases your chance of mortality if you are a healthcare worker working in that kind of context. So this is real. That all being said, I think if we're talking about things like ventilators, then I think it's less clear, I think, in that kind of context, because if you require a ventilator, it's because you're seriously ill, and it might take you many, many months to recover fully from being on a ventilator, even if you do recover. So in that kind of context, we shouldn't just assume that healthcare workers should get priority to be on a ventilator because they might actually not be able to contribute to society's good in relation to this particular pandemic. But then if you accept the reciprocity argument, maybe that's a reason why you would still prioritize healthcare workers. So when we're thinking about the triage situation of there being scarce resources and who or how are we going to prioritize, I think these are a number of the different complex factors to take into account. But generally speaking, healthcare workers ought to be generally a priority group. And for example, when it comes to the provision of pandemic vaccine, hopefully in the near future, then I think there's a reasonable argument for saying that healthcare workers should be a priority group when it comes to distributing the vaccine because of the additional risk that they face in their interactions with the general public.
Okay, well, Evelyn, there's your answer. That was exactly the next question about who should get the vaccine first. So moving right along. Nanita, nice to see you, another longtime member of our program. She asked, most of ethics committee members are placed in the dilemma and critical position to approve clinical research related to COVID-19 studies, policy development, or vaccines discovery research. How can members of these ethics committees create a balance and sound decisions pressured from beneficence and non-maleficence?
Yeah, I think the first thing is to accept that it's difficult because you're making decisions often in a situation of no evidence or poor quality evidence. So I think making sure that your committee is diverse and has representation from different groups in society, so you can get input from people that are potentially impacted by the interventions that you're talking about, having a robust and critical discussion, so ensuring that all of the members of the committee are invited to speak. As somebody who has sat on many committees, I think the actual culture of different committees is very interesting. So some are very welcoming and encouraging of discussion and debate. Others are quite tedious. You know exactly what's going to happen, you know who's going to speak, who's going to say what. You get to know very quickly who are the dominant voices. And I think that's part of the problem here, is that when it comes to thinking about the different kinds of calculations of risks and benefits, we need to make sure that we have all of the risks and benefits being discussed. So thinking here about the key issue I was talking about in relation to research ethics, this kind of focus on the speed of producing a vaccine or a treatment is a really powerful argument. And the thing that's doing the work there is thinking about all of the 6 billion plus people who could potentially benefit. And the danger is that we don't actually take into account other potential problems that there might be. So it has certainly been the case in some vaccine trials that there have been problems that have emerged because of exposure previously to the disease in question. So we know so little about this particular virus. We know so little about the medium and longer term impact that it has upon the human body, the immune system, and so on. And we don't know how that might interact with vaccines. So I think it's really important that we are cautious and we make sure that we include discussion of those potential risks as well as the potential benefits of having an effective vaccine for all of the planet's whole population. We also need to think about who it is who benefits and who is potentially at risk. So again, there's a distribution question, issues to do with justice that we also need to think about. So whenever we're thinking about research ethics, or we're thinking about policy response to pandemics, let's have a diverse group of people. Let's make sure that we're talking about all of the relevant issues and that we don't just shortcut to what looks like the obvious answer, but it actually turns out that it could potentially create more longer term problems. For example, if something goes wrong with a pandemic vaccine, what kind of impact might that have on routine childhood vaccinations, what kind of impact might it have on trust in public health systems in general? So what looks like an immediate kind of benefit could actually turn out to have longer term consequences that actually result in overall poorer outcomes. So I think these calculations, these discussions are extremely complicated, and we need to make sure that we take into account all of the relevant considerations.
We just have a couple of minutes, but related to this, Rolando asked, there's some news that some developed nations have already earmarked for their own use the COVID-19 vaccines that will be developed. How do we safeguard that the poor nations are given equal opportunity to be allocated these vaccines? Do you know if that's true or?
Yeah, I mean, that's a great question. So part of this relates to where there is the capacity to manufacture vaccines and where companies are located. And of course, most of those are in high-income countries. And some countries are certainly trying to prioritize their own citizens. Now, some people argue that that's legitimate because the primary obligation of a state is to protect their own citizens. But many other countries, there was recently a discussion in Europe through the European Union to work with organizations like Gavi to try and ensure that the distribution is on a more just basis. So some of that might be logistical, technical issues about how you get the vaccine out to lower middle income countries from the manufacturing centers that are generally speaking in high income countries. But it's also about ethical considerations to do with justice. So what is the basis for the distribution of vaccine across the world? Again, it comes back to thinking about different kinds of values and where we want to choose to prioritize. You know, at the global level, do we focus on those that are more vulnerable? Do we focus on the best possible benefit for the interruption of the transmission of the disease? Do we protect healthcare workers as a priority, et cetera, et cetera? You know, we have a number of different options. If we're thinking about this logically, if we're asking the ethical question, you know, how should we distribute vaccine? If you're asking me the question, what is likely to happen, then I think we know what's likely to happen, which is that many countries will actually prioritize their own citizens, and it will be high-income countries that will actually benefit. But I think one of the relevant issues at the moment is that we don't know which vaccine will be successful. So there's an argument for saying that it's actually in every country's interest to have a more rational and fair and just distribution principles for the allocation of vaccine, because it might be another high-income country that has the success in relation to developing the product, which might mean that you're at the back of the queue.
Yeah, okay, well, I always learn so much when I hear you talk, so thank you for helping to distill down all those considerations. We had some other excellent questions that we didn't get a chance to answer, but thank you for those. I also wanted to remind you, everyone, again, please register for the next one. Next week is about environmental impacts. Professor Khan from Fudan University in Shanghai. The following week is about migrants, and our speaker comes from the University of the Philippines. So right there you go. Dr. Jean Encinas Franco will be talking about overseas workers, so that's in 2 weeks. Also, thank you again to our speaker, Professor Angus Dawson from the University of Sydney, as well as the team from the APRU Secretariat for all their hard work. And these slides will be made available along with the recording for those who have registered. So thank you once again for taking time out of your day, everyone, to join us. I hope you enjoyed this. Take care.